this is a really serious subject, but again, if we don't talk about it, we can't do anything about it. The topic of physician suicide. Women physicians have 250 to 400 times higher rates of suicide completion than women in other professions. For men, it's
Hello, thank you all for being here on another episode of Your Health is Your Greatest Wealth. This is Blanca, and I am here with my distinguished guest, Dr. Erin Hurley. And Dr. Hurley happens to be, in addition to a physician, she is a high performance wellness coach. So with that, Erin, tell us a little bit more about you, how you got into wellness, how you became a high performance wellness coach, and everything that you also have going on.
Well, thank you for that. And so glad to be here with you, Blanca. And my journey into becoming a coach actually is pretty familiar. Many other physicians that I know who are also coaches got coaching themselves. And in medicine, we're not very good at asking for help. And I know I heard a few weeks ago the statement, ask for help before you need it. And that really put me in a little bit of shock because in medicine, you don't even ask for help when you do need it. And then learning to ask for help before you need it, that was like, wow, that's really brilliant. Kind of shook me a little bit, that concept of ask for help before you need it. I have no idea why I signed up for a coach. I was feeling sorry for myself as a pity party. And for my 50th birthday, I gave myself the gift of getting a high performance coach, even though I didn't know any other physicians who had coaches, didn't know any other individuals or professionals. I just knew I needed to do something differently because my results weren't great. Trying to get them done on my own 2 decades into my career as a physician leader, having kids in their early teens, tweens, and I wasn't happy with the results. And as a result, like I said, ended up in a huge pity party on my 50th birthday. And I said, you know what? I'm going to celebrate myself all year long. And when the invitation to sign up with a high performance coach came along, I bravely said yes, even though I had no idea what I would get from saying yes to that. And the results were so powerful. I'm a very fast implementer. Within 3 to 6 weeks, 3 weeks after I said yes to the coaching, and my husband was like, you did what? You bought yourself what? 3 weeks later, he stopped arguing with me about it because I was showing up differently as a spouse and as a parent. And within 6 weeks, I had broken 20-year-old habits, being the last one at the office, coming home 7, 8, 9, 10 o'clock at night, even though the office closed at 5, being there nights and weekends, even though the office was closed. And I had such dramatic results in decreasing my exhaustion and overwhelm. I didn't call it burnout, but that's what I resonated with, exhaustion and overwhelm, that I was like, if I could get these results, I could do the same for other healthcare providers, other women in medicine. And I started with coaching before the research had even come out. In 2019, we started seeing articles showing research-based improvements for specifically physicians, decreasing scores on burnout and improving scores of well-being. I just am grateful that I signed up for it before I waited for the research, because now I had all of these years, I didn't wait for somebody else to do it for me. I invested in myself. And it was so powerful. Again, then I wanted to turn around and say, what can I do now to pay it forward, turn around and help other women physicians, other healthcare providers who are struggling like I was struggling.
And so, Erin, I'm glad that we're discussing this topic. The one thing I found really interesting the last several years is I happen to have other friends in the medical field, whether they're nurse practitioner, nurses, doctors, and I think it's very ironic that these individuals that are in healthcare themselves are some of the most unhealthy people. If you know anyone that works in the medical industry, there's graveyard shifts, they're very long, they have families and lives of their own, and a lot of times they don't make time for their own health and wellness. And it's great that you're doing that. Typically, what is it that clients come to you for, whether they're, I guess, other physicians, doctors, or just clients in general looking to improve their well-being? What is it that they're trying to change?
Oftentimes, what the pattern that I've seen, especially for healthcare providers, as I shared, we don't often ask for help. And I liken it to like they are teetering on the edge of a cliff. And that's what will get them like, I'm going to fall off the cliff if I don't do something right now. And then somebody reaches out. or their friend says, hey, I know of this physician coach. She seems to be getting these good results. Maybe you should connect with her. And sometimes then people say, yep, I'm struggling. And I've had people just their entire lives are falling apart. I tend to attract that, whether it was when I was in medicine, I would have the most complicated patients, the most complex call. And as I've become a coach, I also tend to attract really complicated individuals who have really horrendous or complicated things going on in their lives, not all of them. And for me, I'm glad that I have the capacity to manage or even know like you're not even to a place where a coach is going to help. First, you may need to get mental health or get things more stable before I can help you and intervene. So understanding that balance. But people are oftentimes just feeling like I am at rock bottom and what I've done for myself hasn't helped yet. I'm going to go ahead and ask for help and see what happens. And many of the people who've worked with me know me as a physician in the area. We've worked together or they've met me through different medical organizations or somebody they know has met me. And they come to a realization doing it myself isn't working.
Erin, there is just so much with what you said, including the asking for help before you need it and mental wellness. The real conversation that I think more of us need to have is why don't more people ask for help, especially when it comes to mental wellness? And although we've made improvements, there's still so much stigma to people acknowledging that they need help when it comes to mental health. So can you address that issue a little bit more?
I think in general, our society has had many stigma against not just mental health, but as I look back at other things that have affected my life, I'm a cancer survivor. And 50, 75 years ago, you used to not be able to talk about cancer at the dinner table, especially not anything to do with reproductive organs or something that was hush hush. Now we can talk about cancer. Now we can talk about prevention. Now we can talk about treatments. And it's not a secret. I worked in child abuse medicine for 10 years. If you can't talk about abuse that's happening, guess what? You can't do anything about it. So mental health is still in that where, especially for physicians and healthcare providers, many of them worry not only about the stigma of mental health, but in many states, in order to get credentialed, in order to get licensed by your state's medical board, many states will ask you if you've had mental health intervention. So whether you just lost a child or a family member, whether you've had a divorce or some other impact and you're just having normal grief and you're choosing to get help, there have been healthcare providers who've been penalized because they have reached out for help.
Wow.
Yeah, this is a really serious subject, but again, if we don't talk about it, we can't do anything about it. The topic of physician suicide, women physicians have 250 to 400 times higher rates of suicide completion than women in other professions. For men, it's maybe 1.5 times or maybe higher than that, higher than men in other professions. It's profound. So talk about not reaching out for help when you really need it. That's to me a horrible way. We lose about a physician a day, 300 to 400 physicians just in the US to taking their own lives. And those are the ones we know about. Tragic.
Yeah, I had heard about that about first responders because I know they're exposed to so much. I had never heard that about doctors, but it makes sense. Some of the first responders I've heard it from are individuals that worked in EMT. And I guess as doctors, you see so much.
I worked in child abuse medicine. The interesting thing is my husband is an EMT medic and works for the fire department. So he's
Oh.
finishing up a 30-year career. So between the two of us, we know a lot about trauma exposure. He's been part of this peer support. So we're making headway because in the medical or in the fire department with ambulance companies and also with our law enforcement, we are all exposed to a whole lot of trauma. And if we don't learn ways to unpack that and address that, for some people that might be, psychotherapy, for others it might be coaching, for others it might be EMDR, which is a specific kind of intervention that some counselors can do, some therapists can do to help decrease the effects of trauma, decrease PTSD. And so I have a deep understanding of the effects of that as well. And even on our kids who grew up with two parents in these fields where we have a lot of trauma exposure. And yet I think because we learn to deal with it because of our professions, we actually, when trauma hit the world in the face of the pandemic, when everybody was now exposed to deep-seated trauma, primarily or secondarily, we actually went into the pandemic with a lot of skill sets that many people didn't have because we'd already been dealing with trauma. And I feel like so many people are still reeling from the effects of that. It's not going to wash out. The effects of the pandemic aren't going to wash out for probably decades and generations to come, just based on what I know about trauma. And some of us went into it better prepared than others, and other people need to do some catching up in order to continue to deal with the aftermath and the higher levels of mental health issues that are going on, not just in adults, but in our children and our teens, unfortunately.
That is definitely a topic I would love to dive in deeper with you for a different day. Children and suicide, as you know, it's something that's touched my life personally. You happen to have a platform called Happy Healthy Healers, and your goal is to help other physicians just with self-care. Talk a little bit about that and the whole concept of self-care.
One of the unfortunate things that happens in medical training is that we may have zero self-care. We may not even be given time. If you're in an OR, in an operating room, in a long surgery, you may not get to use the restroom for 8 hours, 10 hours at a time. You're not getting water, you're not getting nutrition. You may be up for 36 hours at a time. And I look at it as you're just given this enormous, assignment of things to do. And it's like, get it done. We don't care how you do it. Whether that means giving up your sleep, your nutrition, your ability to exercise, your relationships with your family.
Mhm.
And unfortunately, what that does is during medical school for 4 years and then into residency, a minimum of 3 years in the US, those habits are now ingrained in you. Once you get out, you think, oh, it's going to be all better, but nobody coaches you or helps you figure out, oh, now how do you feed self-care back into it? And there are some people who have figured out how to take better care of themselves, even during their training. I talked to one person who slowed down their training. It took them longer to get through their medical training because they were married and they had young kids. So they chose to go through it slower, add more time on there in order to not have the negative, I call it collateral damage that can happen. And so one of the things I do is I try to help my clients unlearn, just like I needed to unlearn those bad habits, shunning boundaries. No, actually boundaries can be respected and even embraced if you're going to then learn the self-care, because I look back at my career and I think when I started doing self-care after I started working with a coach and I started respecting my own sleep, I started infusing healthy habits like taking 10 to 20 minutes for a meditation at the beginning of my day to say, I'm tired. I'm going to close my eyes for 5 minutes and take a break from this computer screen, or go outside and take a walk for 5 minutes. And what happens is that when you pour from an empty cup or a gas tank that's only got fumes in it, you have nothing left to give. And can we instead learn to put in better quality fuel, longer hours of higher quality sleep, better nutrition, a little bit of exercise, more social connection, instead of kind of the martyr way of doing it, self-sacrifice.
Right.
And then you go, oh my gosh, when I take that break midday, my patients get better care in the afternoon. When I've taken good care of myself throughout the day and I come home to my own family, they get a better version of me than the leftover crumbs when I've left it all at the office. And yet there's so few role models who are doing that in medicine. And I talk to my clients and I say, I want you to be a unicorn. I don't want you to get typical results like normal doctors, because we have really horrible results, high divorce rates, high suicide rates, high mental health issue rates, high burnout rates. I don't want you to get those results. So let's not do those habits and activities that people who are getting those results are. Let's do something different.
And Erin, I'm really glad that we're talking about self-care, because I think that's a topic and a modality that a lot of people don't enact regardless of their industry. And many individuals actually view that as selfishness. So, how can we help those that either have the stigma of taking time for themselves for self care? How can we have them shift their mindset that no, it's not selfish? And alternately, I have also been in communities, being Hispanic myself, where when you did self care, your family members, your community made you feel as if that was selfish. So it wasn't just your own thoughts, it was others telling you you're being selfish for doing that. Even for things like exercising, which is improvement of your health. So how do we shift that mindset and that conversation that self care is not selfish?
That's so powerful. And I tend to use those same words myself about the lack of selfishness with self-care. It's a necessity. And when you talk about, I'm not part of the Hispanic culture, but in my family, the women in our family worked really hard. We were always the last at work. I've learned more and more about ADD, ADHD in women, and oftentimes being undiagnosed. And it makes me scratch my head and I say, I wonder if that had some effects. But even though they weren't in the medical fields, no one else in my family was, my role models, the females in my family, had very similar hours to me. And so when we look at what's the culture in my family, what's the culture in my workplace? And I actually remember asking somebody that mentors and coaches us, Brendon Burchard. I remember in the beginning of my personal growth journey, and I felt like I was the only one in my entire office who was starting to recognize these shifts as I worked with a coach. And I remember raising my hand and saying, Brendon, I'm the only one in my office. How can I then take a break at lunch and not look lazy? Because the norm is you're chained to your computer. And his suggestion was invite them to my next conference. Let them hear about how to be a high performer. Buy them a copy of my book. And I actually did invite my CEO to one of the future events that Brendon hosted. And then I just started role modeling differently. I started inviting my staff to go on a walk when we were done with our morning assessments. And by the time I left that work, the norm shifted from you're chained to your computer because you've got work to be done to no, now we oftentimes invite each other to go on a walk outside with other colleagues, shift our energy, move our bodies, get some water to drink, connect with nature a little bit. And now guess what? When we get back to the office for our next session with our patients, they're going to get a better version with us. And now when you can now raise awareness, because now you've seen, so I look at it like this, I raise awareness, like taking a break actually increases your decision-making ability. So if your decision-making ability fades quickly once you show up to the office or to your workday, if you don't take another break, you're now functioning at the bottom of your decision-making curve. So now I've raised your awareness to that, Blanca. If you didn't know that, or if your listener didn't know that taking a break will now pop you back towards the top of your decision-making, you take no break throughout the day, you're going to function at the bottom. Raising that awareness, now live it. Try working with taking a few breaks throughout your day. And now I ask you to measure your energy at the end of the day. How quickly can you make decisions at the end of the day versus the beginning? And now you not only have awareness, like the intellectual knowledge, now you've experienced it. And now that you've felt like, oh, this is what it feels like. If you go back to that old version, you might go, whoa, 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 I don't like that anymore. I've experienced this new way of doing things better. But it's a multifaceted journey to raise the awareness. So that's something we can do with our culture. Show them research, show them numbers, and say, oh, you might think that taking a break is being lazy or exercising is lazy. But when I exercise 3 times a week, my productivity goes up by 30%. This is what this expert, and with enough times and enough touch points, or hearing it from other people besides you who have a different relationship than you do, or maybe, hey, here's this great podcast I listened to. Here's this great book when I show the picture of that book from the one thing of this is what happens to your decision making, and I show that research-based information to a physician, they're like, ooh, that shakes up their foundation of knowledge if they haven't read that book or seen that graph.
Erin, that is just so profound. And the one thought that came to my head while you were speaking is a lot of people feel guilty from taking that break, for example, because they feel they need permission. And if someone else doesn't give them that permission to take the break, then somehow they feel like they're taking advantage of a situation, that they're not fulfilling an obligation. And the interesting thing is, it's just their own self-talk. They're making themselves feel they need that permission. No one needs to give you that permission. If you need a break, take the break.
Yeah, I remember so before I actually started coaching, I was doing enough personal growth, getting coached and using those skills as a leader, as the medical director in my organization. I remember celebrating that one of my staff went home because they had a headache. Thank goodness you said, hey, I've got a headache. Otherwise, they would have wasted time being there all afternoon, getting nothing done, being miserable. And instead, now they get to go home, take a break, take a rest, and maybe get back to it, or by the next day be fully recovered and come back as their best self. I was celebrating when the norm in medicine is you don't call in sick unless you're in the hospital yourself or you're dead. How ridiculous is that? I used to tell my own mother, this is super embarrassing, when she would say, honey, take care of yourself, get some rest. And I had 3 young kids. I was a leader in my organization. And I basically this is literally what I said to my mother. I'll sleep when I'm dead, Mom. I don't have time for that. Can you imagine? And now I go like, I can't believe I said that. It's so embarrassing because I really protect my sleep now. And I want to get lots of sleep because it's going to help me with my self-care. It's going to help me with my relationships, help me prevent arguments when I pay attention to what I need. But the other thing I was going to say, Blanca, what you made me think of is that when I tried to solve things on my own, I was coming up with the same Erin solutions and they weren't working great. And it wasn't until I got that outside perspective, that wasn't my spouse, it wasn't my siblings, it wasn't my own parents who were telling me, it was my coach. So I was paying an outside person for their expertise, and their job was to push me out of my comfort zone, to challenge me. And I couldn't make those changes on my own without that. I was 50 and 20 years into my career. And as I shared, within 6 weeks, I was making huge changes I couldn't do on my own. And you may not be able to do it on your own either, especially if your culture, if the role models are completely different than the results that you want to get. That's where the power of a coach can come in, or a mentor, or a paid expert. And I don't know that I'll ever go in my life without having a coach, having not only that, but a group of supportive friends that can call me out, can say, hey, you said you were going to start yoga class 18 months ago. What happened there? That hasn't happened yet, Erin. What promises are you making to yourself that you haven't followed through, or that you're making to others and you couldn't follow through? Sometimes we need that external person to hold us accountable. And sometimes you can get that in a spouse or partner or a friend. And sometimes you just pay for it by having that personal trainer, by having that coach, by having that person who is going to hold you accountable.
I completely agree with that with regards to just embarking on a journey where there's peers, there's mentors, there's masterminds that help you get out of your own head and thinking the same thoughts you've been thinking and having the same beliefs you've believed before that aren't moving you forward, that aren't helping you. And like you, I agree, it takes having outside perspective to help you see that maybe you've bought into so much programming, so many belief systems that aren't really helping serve you or be your highest self or be that better person for other individuals either, because you're not growing. So you can't give from an empty cup. So I so completely resonate with what you're saying. And interestingly, as you were also talking about physicians, congratulating your one peer that you were so proud of for saying they had a headache and needed to go home. I've often thought to myself, do I really want a doctor that has been working a double shift, operating on me when they're sleep deprived? And I don't know if those thoughts ever enter anyone else, but I don't want a tired doctor servicing me. They need to be rested. And I don't know why the system is still the way it is, that it's a badge of honor for someone in the medical field to say, I worked a 16-hour shift or a 12-hour shift. That is not a badge of honor. That is, oh my gosh, you are putting the clients you are servicing, that individual on the operating table at high risk, because how alert are you? And so, I mean, I know that's a different side of a coin, but I think there is so much need for individuals in the medical industry to just have so much self-care so that they can take better care of the rest of us.
And there are, I've heard of individuals who have friends who practice in some different countries where they have, even if you're a healthcare provider, 12 months of parental leave, and then you get to go back to your job. So unheard of things where I've talked to certain healthcare providers who own their own practices and they haven't had any turnover. And I was like, oh my gosh, there's so much turnover right now and burnout and people actually leaving medicine because they just can't figure out how they can handle it anymore. And yet, if these individuals are recognizing, I'm fond of saying, we're not robots. Physicians and healthcare providers, we're not robots. We have emotions, we have needs, we have feelings, we have to eat, breathe, drink fluids, all of those things too. And yet we aren't oftentimes treated like that on our own by our patients, by the organizations that we work for. And it is time that we all recognize we're humans. I know when I go see a doctor or a specialist, I bring my books. I am not on an agenda. I don't double pack. I don't put an appointment after it. I leave a big gap. And I've been forgotten in rooms. And this was a long time ago, like 20 years ago. I remember me and my husband were at an appointment. We were forgotten by the staff. And I had my magazine and I was sitting there. We were very patient and they told us we were forgotten. We were in a different room. We're like, okay, let's just get a scene, and went on from there, as opposed to, I can't believe, I showed up to my doctor and they were running late and they were this and they were that. And I'm like, what I bet is going on in their office? They're short staffed, whether it's their support staff, they're cross covering for other healthcare providers that aren't there, that have left. They're still dealing with ramifications. Their own families are falling apart. And so behind the scenes is another layer of complexities that it doesn't matter if you're a physician, a healthcare provider, a teacher, an entrepreneur, a business owner. Can we all just recognize we're all human beings? And most of us are doing the best we can with what we've been given. And, we've both been dealt with some trauma in our lives. Nobody can see that unless we share it with them. And if we knew what was actually going on in that person's life, if we could see the humanity in them, and maybe if we took better care of ourselves, it gets easier to do that. Or we just say, I don't know what's going on with them, but can I just treat them kindly? Can I treat myself kindly instead of beating myself up? And how much better of a place would the world be when we can see more of that going on?
Wow. And I just say that, Erin, because you gave doctors, physicians, such a sense of humanity. I know I've been guilty of it in the past. My younger version of myself would look at someone in the medical field and put them on a pedestal, like if they're this know-all, end-all, be-all individual, superhuman. And my older self now takes my health into my own hands. I feel it's a partnership with my medical providers and me. However, I still think in the back of my head, I still sometimes have that little programming that still sees physicians as superhuman. They don't need as much rest as me. They don't need all these other things like I do, because somehow they're special and they're different. So thank you for pointing out that, what, doctors are humans too. They have lives of their own. They need empathy as well. They're trying to do the best they can. And there's very good people in your profession trying to make a difference. And thank you so much for being the face of your industry.
And I've chosen to take leadership positions throughout my entire career. And I'm also part of organizations that support physician and healthcare provider well-being. So I'm on my local medical society. I've been there for over a decade. When I was the president of the medical society, I chose wellness to be my forum that I stood on. And now we've got that baked into it's not just a social club, it's about wellness and supporting the well-being. I'm on a unique statewide network in Oregon that is providing confidential free counseling for healthcare providers, including physicians. And so I hear a lot of these things, and I read the research as a person supporting the well-being of healthcare providers. And I've heard just stories that make me very saddened when I hear somebody writing that I just heard that my father had passed and I gave myself 3 minutes and then I walked into my next patient room. I remember early in my career, I was married to my husband, who's a firefighter, and we had a fatal fire in our tiny little town. And I didn't know if my husband was one of those 3 people that we lost. And it was the end of my workday, and I'm like, I got to be done. But I've heard other people who maybe they were going through a miscarriage, didn't tell anybody and showed up to work. I had a similar situation. I was like, I'm on call this weekend and I may be miscarrying and what am I going to do? I got to get somebody to cover for me. That's where my brain went instead of going, oh my gosh, I might be losing my child. That's the kind of, programming, as you were saying, that we have had. And it can take a long time to deprogram that. Even for something as simple as boundaries can be a strength, not a weakness. And again, that's where I love with coaching. I oftentimes have helped shape individuals who had certain thought patterns or perspectives about themselves or judgments. When I do this, I'm so weak. And I thought, you know what? Actually, when you do that, I see it as a strength. And I love flipping that perspective upside down, or your perspective of, well, of course, doctors are superhuman. They're not like me. And actually, we're just the same as you, no different. We just chose a different profession. And so it's just one of those things where, again, making that connection and that human connection, we're all humans. Let's connect on that and have more grace and understanding. And if we are not taking care of ourselves, so we can have emotional intelligence, emotional stability. And I look at it as when you can only look at your own plate, you're so overwhelmed, so overworked, all you can see is what's right in front of you. You have no idea what's going on in the people around you until you pour enough into yourself. You take whatever's off that plate that's overwhelming you, and then you look up and you go, oh my goodness, I had this loss in my household, in my family. I had no idea that you also had such big things going on in yours.
So, Erin, what my goal is that our audience takes away from today is I hope our viewers realize this information does not just apply to individuals in the medical field. So many of us need to do such a better job with self-care and be okay with it, not have feelings of guilt. So many of us need to tell ourselves different stories than what we're telling ourselves now. So many of us need to be so much kinder to ourselves and stop telling ourselves those mean things that we would never say to our best friend. There is such a need for so many of us to just have a mental shift on how we speak to ourselves and the state of grace we give ourselves so that we can show up better for others.
We are so aligned in that, Blanca. I've said those exact same words before, and it is so powerful. And I appreciate you saying that because we spend 24/7 with our minds, and I am astounded at the language that we use with ourselves. And I can't say it any better than you did about, can we think of ourselves as we would a sister, a best friend, a favorite aunt, and ask ourselves, would we use that language with them? And again, if you can't get out of that on your own, that's where a therapist can help, a good friend, a mentor, or looking to see, is there someone in your world that you see doing a better job at being kind to themselves and using more positive language about themselves that's role modeling? Spend more time with them and less time with people who are constantly berating themselves. Pay attention to what's going in and what's role modeling for you. and ask for help. I mean, that's one of the, I've got 3 different coaching certifications, and one of them is kind of like cognitive behavioral therapy, where we shift mindsets. We change our thoughts, which then change our feelings, which change our actions and inactions and change our outcomes. And it has to do with what's that inner thought process that's going on that really drives our reality. Our circumstances don't drive our reality, it's our interpretation of it. And if our interpretation is driving negative outcomes for ourselves, what help do we need in order to shift that perspective, get somebody to kind of shake you up and get you out of that stuck pattern and try something different?
So good, Dr. Erin. Are there any final words you would like to share with our audience today? Including, actually, I wanted to ask you, you have a big project coming up. Will you tell us about that?
Yes, I would love to. I have been working on a podcast with 3 other individuals, so 3 other professional women. And when we took this project on, we knew it was going to be complicated. Getting together 4 individuals, we live in 3 different time zones. And yet, talk about role modeling, we wanted to role model a collaborative approach, that having a perspective of 4 individuals, 4 professional women, can be different than 1 or 2 or 3. And so we are getting really close to launching our podcast. It's called Successful But Struggling. And we're expecting it to launch sometime in probably June of 2024. And I'm really excited. And we're talking about those hard things. Success, yes, people that show up there to listen are going to be successful, but we're going to talk about those struggles that we don't always talk about in public, that might seem taboo or too vulnerable to talk about. Those are some of the things we're going to be talking about on that podcast. So thank you for asking about that.
Absolutely. So great. And I am excited to hear updates as you get closer to the actual launch. I would love to share that with our audience. Thank you so much, Dr. Erin Hurley, for being here with us today. I learned a lot just hearing your perspective from your profession. So thank you. It was very eye-opening. I will definitely approach those in the medical field with a lot more empathy. It's a very tough job. I personally could not do it. So thank you for being one of those who does. Thank you so much for being here today.
It was my pleasure, Blanca. Thank you so much for having me.
Absolutely. Thank you, audience, again for another wonderful episode on Your Health is Your Greatest Wealth. Please like, please subscribe, please share this episode with others that can benefit. And thank you again for being here today on Your Health is Your Greatest Wealth.